alpha-ketonuria was discovered by Dr. Falling in 1934. After that, physicians and scientists around the world began researching treatment methods, with the most effective being the phenylalanine-restricted diet. Before Bickel and his colleagues published their successful results, another chemist played a pivotal role in Sheila's story, chemist Louis Woolf. Woolf's parents were Jewish immigrants from northern Romania who settled in the UK, where Louis Woolf was born and raised in London. After earning his PhD in chemistry, he worked for a pharmaceutical company in London. In 1947, he joined Great Ormond Street Hospital as a researcher, studying inherited metabolic disorders, particularly amino acid metabolism. He developed a filter paper chromatography method to analyze amino acids present in the urine of PKU patients. Woolf believed that the intellectual disability in PKU patients was caused by the accumulation of intermediate metabolites from phenylalanine metabolism. This view differed from Dr. Penrose's earlier opinion that intellectual disability in PKU was purely genetic. Woolf also attempted to design a formula diet low in phenylalanine. He knew that the pharmaceutical company Allen and Hanbury Ltd. produced hydrolyzed whey protein. From literature, he also learned that charcoal could absorb neutral aromatic amino acids, phenylalanine, tryptophan, and tyrosine, from hydrolyzed protein. Therefore, he designed a method where hydrolyzed whey protein was passed through a charcoal column to produce a phenylalanine-free formula diet. By adding a small amount of milk to restore some aromatic amino acids, he created a low-phenylalanine formula. Woolf hoped pediatricians at his hospital would try this formula to treat PKU patients, but none agreed. Instead, about 200 kilometers away at Birmingham Children's Hospital, Dr. Bickel had diagnosed a 2-year-old girl named Sheila with PKU. Sheila's mother persistently pressed Bickel to find treatment. When Bickel heard that Woolf might have a method, he went to London to learn from him. After mastering the formula preparation process, Bickel returned to Birmingham. In the hospital's laboratory cold room, wearing heavy coats, he worked late into the night passing hydrolyzed whey protein through the charcoal column, often ending up covered in black charcoal dust from head to toe. The column used by Bickel to prepare Sheila's formula still exists today, preserved at Birmingham Children's Hospital. Later, pharmaceutical companies commercialized low-phenylalanine formulas, reportedly tasting like spoiled cod soup. To prove that the low-phenylalanine concentration was the key to treatment, Bickel secretly added 5 grams of phenylalanine per day to Sheila's formula without telling her mother. On the very first night, Sheila's mother noticed a dramatic change. Sheila reverted to her pre-treatment state: constant crying, head banging, inability to stand, irritability, and lack of interest in food. This gave Bickel definitive evidence. Dietary phenylalanine and its metabolic intermediates affect brain function and cause the intellectual disability seen in PKU patients. The results were published in 1954, making Sheila the first PKU patient to receive dietary treatment. This success inspired other doctors to adopt dietary therapy for PKU and encouraged manufacturers to produce low-phenylalanine formulas commercially. This was the second major milestone in PKU's history. After 4 years of dietary treatment, Sheila's motor skills improved significantly, but her language development remained delayed. As she grew older, her progress slowed. By December 1955, at age 5, Sheila refused to continue the unpleasant-tasting formula, making her care increasingly difficult. The special formula was stopped and replaced with a regular low-protein diet. After age 6, her condition worsened. She became irritable and unfocused. At 6 years and 6 months, her final IQ test indicated a mental age of just 18 months. Sheila's mother, a single parent with 4 other children, had no income and could no longer care for Sheila. In 1959, Sheila was placed in an institution. Her mother visited regularly for 20 years until she passed away in 1981. Sheila remained in the institution until her death in 1999 at the age of 49. Sheila, whose mental capacity stayed at that of an 18-month-old, never knew that she had played a pivotal role in the history of PKU treatment.